So let me ask you something. What if the medical term for failure was actually a sign of success? Today, we're going to dive into this really critical idea, how the names we give to certain conditions can actually mislead doctors and patients, and why looking at the true essence of what's happening can quite literally be life-saving. You know, Shakespeare's famous question really gets right to the heart of what we're talking about today. A rose is a rose because of what it is, its smell, its petals, its whole vibe, not because of what we call it. But in medicine, what happens when the name we use, well, what if it completely misrepresents the reality of the situation? All right, so section 1, what's in a name? Now, every once in a while, you get these perfect, almost funny moments where a name and reality just line up perfectly. I mean, check these out. An Armstrong who actually has a strong arm. A Dr. Moorhead who, you guessed it, is the head of a computer lab. Or Florence Nightingale, whose name just beautifully captures the idea of a flower and a songbird. It's a great coincidence when it happens. But, and this is a really big but, these perfect fits are absolutely the exception, not the rule. And in the high-stakes world of medicine, a misleading name isn't just a quirky little detail. It can be a serious source of confusion that has real consequences. So, section 2, when labels mislead. This is where it gets to be a real problem, when a medical label makes us focus on completely the wrong target, making us chase numbers instead of just health. And this right here is the trap. The label says obesity, so we get hyper-focused on weight loss. The label says heart failure, so we fixate on cardiac output numbers. But in every single one of these cases, the real goal, the only goal, should be the patient's overall health. The label can make us lose sight of the bigger picture. And it gets even more confusing. I mean, take the common liver function test. When your doctor orders one, what do you actually think they're measuring? The answer is probably not what you think it is. It turns out the standard liver function test, get this, doesn't really measure the liver's function at all. It measures markers of liver injury. These are enzymes that leak out when liver cells get damaged. That's a completely different concept. In fact, a lot of experts argue it should be renamed the liver injury test, just to be accurate. It's another perfect example of a name that hides the real essence of what's being measured. So, section 3, the paradox of kidney failure. And this all brings us to our main case study today, where this whole naming problem becomes absolutely critical. It's a condition called acute kidney injury, or AKI for short. For decades, the medical playbook for a patient who shows signs of AKI has been super clear and immediate. Stop all the drugs that are considered potentially toxic to the kidneys. And this list includes really common, really important blood pressure meds like ACE inhibitors. It seems logical, right? The kidney's having a problem, so you stop the drug that might be harming the kidney. Okay, section 4, a radical idea. But what if that conventional wisdom was not just a little bit wrong, but the complete opposite of what's best for the patient? What if we've been calling something a failure when it's actually a success? I mean, this is a pretty radical question, but it leads to a powerful new way of thinking. What if some cases of AKI, where we see the kidney function numbers take a temporary dip, what if that's not a sign of the kidneys failing, but a sign of the kidneys succeeding at a much, much more important job? This is what some researchers are now calling acute kidney success. See, in certain situations, like when the body's blood volume is low, the kidney is smart. It intentionally reduces its own filtration rate. And why would it do that? To hang on to precious salt and water. This maintains blood pressure, it protects vital organs like the brain and the heart, and ultimately, it helps save the patient's life. It's a protective mechanism. It's not a failure at all. This whole phenomenon is so consistent that it's even been given a name, the checkmark sign. First, a patient starts a life-saving drug, maybe an ACE inhibitor. Next, their kidney numbers, they take a small temporary dip. It looks worse. But then, and this is the crucial part, their long-term health and survival dramatically improve. It's a classic short-term dip for a long-term life-saving gain. So, section 5, how we find the truth. This puts us in a tricky spot, right? The kidney failure idea says stop the drug. The kidney success idea says keep it going. With two totally conflicting ideas, how in the world do we figure out what's actually true? Now, this is so important. We can't just look at past patient data, even with all the big data in the world. These observational studies, they're fantastic for finding patterns and giving us clues, giving us a hypothesis, but they can never prove that a treatment caused a specific outcome because there are just too many other hidden factors at play. To get to the real, honest-to-goodness truth, there is only one tool: the undisputed gold standard of medical evidence, the randomized controlled trial, or RCT. It is the only way we can reliably prove if something we're doing actually works. And as we wait for those big RCTs to come out, what we're seeing is a much more subtle, a much more nuanced view. The expert opinion isn't just always stop the drug anymore. In really severe cases, like shock or advanced AKI, the recommendation is still to stop. But in a lot of other situations, it's becoming a matter of clinical judgment, of shared decision-making. It's not so automatic. And that brings us to our final section, our conclusion. It's a powerful reframing of what the best medicine, what the ultimate miracle drug truly is. And trust me, it's probably not what you think. Alexander Dumas famously wrote that all human wisdom is contained in just two words: wait and hope. And that applies so perfectly to medicine. It's the wisdom to wait for solid, reliable evidence from those RCTs and to hope and support the patient, making sure we don't cause any harm by overreacting to a misleading label. The oncologist, Dr. Vinay Prasad, takes this idea even one step further. He has this brilliant way of framing the scientific mindset itself, that deep commitment to finding the truth through trials. He frames that as a form of life-saving medicine. It's the drug that stops us from using harmful treatments based on flawed logic, or, you guessed it, misleading names. And this is the final takeaway, bringing us right back to where we started with Shakespeare. Maybe the ultimate miracle drug is just the wisdom to look past a label like failure and focus on what's really happening, the essence of the thing. It's understanding that a little dip in a lab value might actually be a sign of success. Because in medicine, just like in life, focusing on the essence over the name, well, that's what truly matters.